In this scenario, Janet Bull, the study PI, will contact a potential participant's primary care physician to talk about participation of a potential participant in the PCRC research study, continuation versus discontinuation of statins. During the call, the PI will give basic information to the primary care physician and inquire about the patient's health. The primary care physician is a bit reluctant at first, but gains a better understanding of the study through dialogue with the principal investigator and agrees with participation.
Hello?
Hello, Chris. This is Janet Bull. I'm calling about one of your patients to see if he might be eligible for one of our research studies. Do you have a minute to talk?
Yeah, I'm between things right now, but I've got about 5 minutes, so go ahead.
Your patient, George Snowden, he might be eligible for our statin study. Do you remember when I brought that up in the General Medicine Division meeting?
Yeah, I remember a little bit. That's several months ago, wasn't it? Can you just go ahead and remind me?
Sure. The study is an NIH-funded clinical trial looking at the discontinuation or continuation of patients who are on statins who have advanced illness with a limited life expectancy. The rationale for this study is to see if patients who have a smaller life expectancy will still get the same clinical benefit, or if there's increased burden from increased medication costs to polypharmacy and adverse side effects of the medication. We're one of 11 sites across the nation participating in the study.
You said George Snowden, right? What kind of life expectancy are you looking for? Last time I saw him, he was doing pretty well, I think. He does have cancer, of course, but he's been living okay with that since May. I've got his diabetes under control, and he's really got quite a positive attitude.
He came up as potentially eligible through our medical record screening through the health system's database, mostly because of his inoperable lung cancer and his pleural effusions. The other thing we noticed is the last time he came into clinic, he was in a wheelchair, which denotes a functional decline. We know that life expectancy is an estimation only, but he would meet the criteria if you think you wouldn't be surprised if he died in the next year. Does that sound like something that fits his condition?
Well, I guess if I think about it, yeah, I think he'd fit that.
Okay, so he does meet our prognosis criteria. Now we need to check on his cardiac history. I noticed from reviewing his charts that he doesn't look like he's had an MI, a stroke, or any cardiovascular event in the past year. Is that correct?
Yeah, that's correct. He does have lots of cardiac risk factors, though. Diabetes, strong family history. He's still smoking. He's got a pretty high risk for MI or stroke.
Well, he does meet our eligibility for the study then, and he would be randomized to either continue or stop the statin. We only approach patients, however, if their primary care physician feels that the risk is not too great for stopping the statin. What are your thoughts on this, Chris?
Well, I kind of wish that his statin gets continued, but I think he's got lots of other things to worry about at this point. From my understanding of the statin literature, he's unlikely to benefit at this point, but I think if he's interested, this study would be fine for him.
Thanks so much. We'll explain the study in detail to him and his family. While I've got you on the line, is there anybody else you can think of who might qualify for this study?
Sure, I'll think about it. If I see anyone else, I'll try to remember to call you, but hey, feel free to call me again about someone from your screening.
Great. Thanks so much, Chris.